live with coverage you trust. This is NBC 10 News at 5.
Plus a new tool to treat breast cancer. All right, Health Check at 5:30. A new tool to treat breast cancer patients in our area. Here's Health Check 10 reporter Barbara Morse-Silva. Barbara?
Hey there, Gene. This new device is designed to remove all the cancer in one surgery, and it only recently, about a week and a half ago, became available at Women and Infants Hospital, the first in our area to use it. Here at Women and Infants Hospital in Providence, they see 400 new breast cancer patients a year.
Our statistics show that about 70% of those patients choose to undergo lumpectomy or are appropriate candidates for lumpectomy.
Dr. David Edmonson is a surgeon in the Breast Health Center who now has a new tool.
So this is the probe we use.
It's called the MarginProbe. It's used during surgery to remove a cancerous lump in the breast.
So out of this area, it sends out radio frequency waves, and that hits the tissue that we've taken out, and it gets the signal back. Normal cells will give one signal. Cancerous cells will give us a different signal, and so it's able to differentiate between cancerous cells and normal cells. All these green bars mean that all these are normal cells.
Red bars go back in.
Yep.
The idea is to remove all the cancer at once. It's not always so obvious.
This is a classic breast cancer here, and you can see the little extensions coming off here. The question here is this cancer coming off extending further? So this is where that device comes into play. I could take this sample out, evaluate this margin, and get a better understanding as to whether or not there's tumor at this margin, whether I need to extend it further this way.
In real time, during surgery, before this device, doctors couldn't be sure they got all the cancer until pathology tests came back. That can take a week. And if that pathology showed cancer was left behind, that would mean a second surgery.
So in that time frame, their treatment is delayed. Probably the second worst conversation I have to have with patients, besides that of telling them they have a new breast cancer, is we have to go back to the operating room to clean up those margins. So that anxiety flares up all over again.
Well, before they started using this MarginProbe system, 15% of the patients who underwent lumpectomy at Women and Infants had to have a second surgery, which is better than the national average of 30%. A study of this MarginProbe released last year indicated this device reduced the risk of a woman having to go back to the OR by about 50%. Women and Infants plans on conducting its own study of the device. For more on this story, you can log on to turn10.com and click on health. In other health news, there's a new study that finds Botox could have increased effects on the skin's ability to appear more youthful. Canadian researchers studied the effects of Botox on women treated for mild wrinkles of the forehead and around the eyes. They found the injections increased pliability and elastic recoil of the facial skin. In 4 months' time, the skin returned to how it was prior to treatment. For more on this study, you can go to turn10.com and click on health. Well, a big boost to some healthcare providers in our area. The Rhode Island Foundation today awarded $250,000 in grant money to 5 healthcare providers in our area. Among those who will benefit, Hasbro Children's Hospital will be getting almost $50,000 to expand its primary care for children and teens by opening its clinic on Saturdays. Planned Parenthood of Southern New England is getting $50 grand to expand its services to include primary care to better serve the community. And the Providence Center is getting more than $61,000 to make available wellness programs for people with substance use disorders. Now, those wellness programs will take place at the Providence Center's Anchor Recovery Community Center in Pawtucket and the Kent YMCA in Warwick. And that's Health Check. Barbara Morse-Silva, NBC 10 News. Gene?